Okay.
Okay, my name is, if everyone's ready, we are joined this week with DeAnne Yon Bruner and Katie Wright from the Tallahassee Memorial Health. My name is Lacey Ballinger. I'm the Director of Collections and Exhibits here at the Tallahassee Museum. Thank you for joining us for this week's version of Museum Mixology, Sipping with Science, our virtual lecture series that happens every Thursday at 6 p.m. Eastern Standard Time. We also have versions of Museum Mixology, A Toast to History, Sipping with Science, and Cocktails and Crime. So I hope if you haven't joined us, this is your first time, maybe you can join us for another one, or you've done one in the past and you've had a chance to stop by Madison Social and pick up a curbside to go, something for this evening. Whatever you pick up, a small portion is contributed to the museum, so we appreciate that. And if you didn't go by there, we appreciate anything you're able to donate to our virtual tip jar, which I've posted in the chat room, the link there. And we greatly appreciate your generosity and loyalty to the museum. This evening, we are again joined by DeAnne Yon Bruner, and she's the Clinical Nutrition Manager and Director of Patient Services for Sodexo at Tallahassee Memorial Health Care here in Tallahassee. DeAnne has been a registered and licensed dietitian since 1996. She obtained her undergraduate degree from the University of Florida and obtained her master's in business administration from St. Leo University. Within her current role, DeAnne is responsible for the nutrition operations for Tallahassee Memorial Health Care that includes the development, implementation, and oversight of clinical nutrition programs that involves the reimbursement and regulatory compliance. Also, DeAnne is one of the leaders in the organization's corporate responsibility plan, which includes malnutrition, food insecurity, and food waste. She is recognized as a subject matter expert in nutrition operations for her organization. She's also a preceptor for dietetic interns, Florida State University, Florida Department of Agriculture, and Sodexo. She recently attained her white belt in Six Sigma Lean, as well as completed the Distinguished Managers Leadership Training with Sodexo. Her role demonstrates a unique career path as a registered dietitian that has led to nationally recognized programming within Sodexo. So if you are ready for everyone, we will be watching and listening to DeAnne. And if you see another speaker, that's Katie. Katie will be joining us tonight. Katie Wright is an FSU graduate student in her second year of her doctoral degree, I believe, and so she'll be joining us as well.
Good. Y'all ready? Well, thank you. So this is fun for me. I don't get to do all the boring regulatory stuff, so this is a fun thing for me tonight. So thank you all for joining us. Today we're going to talk about nutrition and immunity, which has really become a little bit more in the forefront, especially with the pandemic going on, how things have significantly changed over the last 6 months. So what we're going to, and I'm sorry, my mouse is really sensitive. So if I'm trying to get it to stop moving. So the first thing is like, how do you get sick? You know, what happens? The way you get sick is 3 different ways. One is becoming in contact with a person through the air or contaminated surfaces. So what you want to do is make sure that there's certain things. If you're sick, you want to make sure if you have a chronic condition, you just want to be mindful of that kind of stuff. Airborne is one of the hardest ones to control. That's the reason why they're now doing the 6-foot socially distancing and the mask wearing, just because of the airborne. But contaminated surfaces is just really easy to make sure you keep a clean area and person contact. It's just to make sure you wash your hands. And that's one of the #1 things to prevent illness. The immune system starts from our head and goes all the way down to our feet. So the #1 immune system thing that we see is basically your skin. So your skin is the #1 protector of preventing things getting into your body. Then the next one is your respiratory system. It's your mouth and your eyes and your throat. So you want to make sure that you know, they protect us from getting infections. They're like our natural filtering part of our body. Along with your tonsils, if you still have them, we have our lymph nodes, our spleen, and then also you have basically your GI system. So the your kidneys, your liver, and your intestines are basically the filtering things and the detoxifications of your body. So as long as we have a healthy liver, healthy kidneys, and healthy colon, they help us get rid of the toxins that we can consume that can get into our food and stuff like that. So how do we protect ourselves? So the CDC has a lot of guidelines, and really it's been basically the same guidelines that have been. The only new one that we've come to is about the mask wearing. That's kind of new to us. But the number one prevention of bacteria and viruses is washing your hands. And I cannot stress this enough. It is something that's a normal practice that everybody should be doing, and is nothing new. I think the one thing that the pandemic has brought about is people are more conscientious about washing hands now. But when you're a food safety expert, I will drive you crazy over hand washing. So you want to make sure that we do that. And there's a proper way to wash your hands. You know, you always want to make sure you have soap, water, and a paper towel or a dryer. Those are the three main components. And you want to make sure you wash your hands for 20 seconds. You want to make sure you get them good. And the way to scrub your fingernails is you go on the palm of your hands. You want to count and do that for 20 seconds. You can count, you can sing a song. A lot of people have learned happy birthday singing the songs, but that's the number one way to prevent bacteria and viruses from transmitting from person to person. Also, if you do not have the ability to wash your hands, you can use hand sanitizer, but you want to make sure that all those pretty hand sanitizers that smell really good have at least 60% alcohol, which is really important. That's what kills or minimizes the number of bacteria on your hands. So what you want to do is the same thing as you do with hand washing. Sometimes people just put hand sanitizer on their hands and just let it air dry, but you physically have to sanitize your hands for 20 seconds, just like washing your hands, and you would do it the same way you wash your hands as well. Also, be mindful if you're a hair player, if you touch your hair or touch your face, you want to make sure you don't want to touch it with unclean hands. And if your hands are visibly soiled, that's when they need to be washed. So sometimes hand sanitizer will not replace hand washing. You also want to avoid contact with people who are sick. The number one thing I tell everybody, if you're sick, stay home. Does not matter what you have, but if you're sick, you need to stay home. So if you have fever or any kind of GI distress, such as diarrhea or vomiting, you need to stay home. Those are signs and symptoms of your body fighting infection that you can carry to another person. So if you don't feel well, just stay at home till it goes well. That symptoms, normal symptoms should be gone for with 24 hours once you're safe to be around somebody. The new thing now is to wear a mask and keep your distance while around others. And yes, now masks have now become an accessory. So now we see all the pretty masks. In healthcare, we do wear surgical masks or certain masks we have to wear when we come in patient contact. And you'll see in the non-patient areas, we do wear, you can wear a cloth mask. But the one thing about cloth masks, you also want to make sure you wash them routinely, because remember when I told you your mouth and your nose are your filtering systems of your body, they can also get into your mask. You just want to make sure that you wash your mask routinely, and you can do that in, don't do it in the microwave with metal. I did that earlier this week and decided to burn up my microwave and my daughter's mask. So she was very unhappy about that. I didn't know it had metal in it, but you can also put it in the microwave. It does not have anything that's flammable. You can put it in a dishwasher because the temperature of the dishwasher gets very high, or just in regular in the washing machine. I have a little netting bag. I just put the mask in the washing machine and spray them down with OxyClean, and then I clean them. And then number one thing is to make sure you clean frequently touched surfaces, and that's doorknobs, your cell phone, your TV remote controls. Make sure your kitchen is clean. And what we have a thing in food service is wash, rinse, and sanitize. But you just want to make sure that you're in the kitchen, that if your counter, to make sure you clean it and let it air dry. That's the number one thing. You don't want to put a cleaner on something then wipe it off. That's the reason you want it to air dry. That's called the efficacy of the cleaning. And the purpose of different things have things to air dry. So it's very important to let your surfaces air dry once you use it with a cleaning solution. So what can you do to minimize your risk of illness? You want to make sure you keep your immune system strong. And it's just not through nutrition, it's also through physical health and mental health as well. I know a lot of people with working from home, being off for an extended period of time, having children, trying to learn how to do virtual school and all that, isn't very much of a strain and stress to people. Also, depending where you work at and depending on who you're around. Like I have an 81-year-old mother, so I'm very conscientious about being around her because I do work in an environment where I work around a lot of people. And the last thing I want to do is to take something to her. So sometimes I can be able to really, it can cause stress, more stress in someone's everyday lives. So you need to make sure you have a mental way to de-stress. It can be from an audiobook, taking a short walk, playing a game on your phone, whatever you do just to keep your mental health and to keep you where you're not so stressed out. Physical health is very important. We all recommend that everyone should exercise at least 3 times a week. And I'll be honest with you, even as a registered dietitian, as many years as I have been, sometimes that does not happen. But it's important to move around and make sure, especially if you have a desk job, to make sure if you're stationary, to at least take those breaks to where you can get your steps in a day and go walk. All you have to do is just to go take a walk around the building or take a walk around your block. And it was really hot outside, but also with the gyms being closed, there's a lot of easy workouts. There's chair workouts and everything on YouTube that are free. So it's a good way just to keep your physical health good. And the nutrition. Now, I am not the food police. I do not tell you not to sit there and go eat a cheeseburger and french fries because that's fine, but it's in moderation. So what the point of it is that you want to make sure you have a healthy, balanced diet overall. So my philosophy is there's 7 days a week and you eat really well 5 days out of the week, then that means that 80% of the time you've eaten well. So nutrition does play an important role, and there's certain things that we want to include into the nutrition to make sure that we are helping with our immune system, prevent us from getting sick. So our health is directly related to how our bodies affect infection and viruses. And so what you do is that what does the immune system have to do with all this? So you'll hear the word about inflammation. And inflammation is the key component of the immune response. How I explain inflammation to someone is like if you're sick, your body's inflamed, it's trying to fight off an illness. Or if you have a chronic disease such as diabetes or heart disease, we want to minimize the risk of something inflaming in your body to where your immune system becomes compromised. So poor nutrition status is associated with inflammation and what's called oxidative stress, which is kind of a lot of fancy nutrition metabolism words. But the main thing is that we want to try to keep you as healthy as you can where your body's not fighting something. Now, if there's a deficiency in certain nutrients that's required to keep your body healthy and to reduce that inflammation and oxidation, then that's when you have a tendency to become sick. So it's very important that we want to make sure that we have a healthy diet to include nutrients in our diet to make us have a strong immune system and minimize the risk of inflammation. So there's several conditions that low-grade systemic inflammation can occur. Some with cardiovascular disease, have inflammatory bowel disease, this is a gastrointestinal disease, diabetes, arthritis, cancer, obesity. These people have a higher risk for infection. That means that their body's already fighting a chronic condition, so their body already has a mild inflammation, and the last thing we want to do is make that inflammation even worse. So what's important for your immune system? There are things called essential nutrients. That means that our body does not make that nutrient, and we have to consume it in our diet to make sure that we have enough of that nutrient. And some of those are vitamins and minerals, and then we need those vitamins and minerals to make sure our immune system stays works best and stays healthy. We get these nutrients from eating the foods in our diet, and also they work together to improve and increase the defense and increase the number of our white blood cell count. So our white blood cells in our body, our red blood cells you'll hear a lot about, but the white blood cells are our little fighters, our little soldiers that go and march in and try to fight the infection when someone is sick. We also have natural compounds in our foods are called phytonutrients and antioxidants. And these are found in plants, and they are very, very good in defending of our health. They're naturally occurring. From a plant standpoint, it protects them from the fungus, the germs, and the insects. And also they're responsible for the color and the taste and the smell of plant foods. So like if you see something that's really pretty and purple, that's really rich in phytonutrients. And we'll show you a chart about that. The phytochemicals have extraordinary properties. They protect you against those your body being inflamed. They have anti-inflammatory and anti-cancer factors. That's the reason why we want to include the fruits and vegetables in your diet. So you want to have a colorful plate and a colorful meal when you do that. Also, they're antioxidants. So for me, who is getting older, I like to make sure I include something to prevent aging, but it prevents your cells from damage. So we want to make sure we have healthy cells, and we have to feed them with good things. It's kind of like when you feed your plants. If you don't, or it's like your car. We have everyday gas, just the regular gas. We have mid-grade gas, and we have supreme gas. And sometimes your supreme gas is your high end, and it makes your car run a little faster. So you have to think as food as energy for your body. So you want to make sure that the energy that you give your food, the fuel that your body, is a high-grade fuel. So you want to make sure you include things that have vitamins and minerals in it, the phytonutrients, and the antioxidants. So here's a chart of what phytonutrients are. So you'll see that the darker, deeper color of the purples and the blacks and the blues will have a higher count of phytonutrients. So a lot of stuff that is available to us. Yearly now, when I was growing up, we used to have fruits and vegetables that were seasonal. Now everything's pretty much available year round. But berries, figs, plums, eggplants. Some people live in North Florida. They're used to muscadines, which is a type of a grape. So they're very dark and purple. Kale, kale salads are becoming more prevalent on menus and everything. So just adding small berries to your breakfast, to your pancakes, or to your fruit, or just a handful will add some of those protective properties in your diet. You have your red vegetables, your orange vegetables, your yellows, your greens, and your white, tans, and browns. So what you want to remember, the more colorful and deep color that the vegetable, the fruit is the more the higher phytonutrients is in it. So there are vitamins that we eat that help us protect us. And our body does not make vitamins, so we have to eat them. So you have vitamin A, vitamin E, and vitamin C. The one thing I want you to remember, though, is there's certain different types of vitamins. So when you do mega dosing on some of these vitamins, some of it can be toxic to your body, and some of it can be you're just going to excrete it in your urine. So you're just going to pee it right out. So when you take an excessive amount of vitamin C, if your body does not use it, it's going to excrete it. So you just have to be mindful about the vitamins and what you're taking in those mega doses, especially if you have certain chronic conditions. You just want to be mindful of that. And there's 13 essential vitamins and 16 essential minerals. And like I told you earlier, that means that you have to eat that, you have to consume that our body does not make that. And there's certain ones that help us do things. So the vitamin A and the vitamin E and the vitamin C that's on the screens, they help our white blood cells protect our bodies better. Also, they're antioxidants, and they help to prevent diseases. And then you can see they have the different areas where you find these different vitamins in. So your vitamin A is I always remember vitamin A was the carrots with the rabbits and the eyesight. So vitamin A can be found in carrots, broccoli, oranges, red peppers. So your vitamin E's are usually found more in your nuts and your avocados. And your vitamin C are usually found more in your citrus fruits, such as oranges and strawberries, and also tomatoes. Vitamin A is a fat-soluble vitamin. So it's one of those vitamins that you have to be careful on mega dosing because it can be stored in our fat cells. So it promotes your skin and your eye health. It helps, has a healthy grow and distribution. And again, it protects the body from infections. Vitamin E is also one of those fat-soluble vitamins. So you have to be mindful of how much you eat of those. And they have an antioxidant property. So it also supports a healthy heart and prevents some types of cancer. But just remember, before you ever start a supplement of a vitamin or mineral or any kind of supplement, you always want to make sure that you discuss it with your physician to make sure it does not have an interaction with any kind of prescription medications you're on. Or if you do have a chronic disease, it's not going to make that disease worse. You always want to make sure if you go onto a supplement, you want to review that with your healthcare practitioner. It can be your nurse practitioner, your physician assistant, or your doctor. Vitamin C is a water-soluble vitamin, so it doesn't matter if you take in vitamin C, if your body does not use it, it's going to just excrete it in your urine. So a lot of people hear about vitamin C, especially in cold season. You'll go see in the pharmacy, the over counter, you'll have stuff. They'll say take vitamin C if you go on a plane or something like that. But studies have shown that it does strengthen the immune system. It repairs damaged cells, and it fights off those little invaders that we don't want in our body to make us sick. And primarily you can find your vitamin C in fruits and vegetables. And you have to remember the raw form of that will maintain the vitamin in it. When you cook something, you will lose some of those nutrients naturally in the cooking process. But like just drinking a glass of orange juice or eating an orange is a really good source of vitamin C. There's been a lot of talk about fatty acids and what's good fat, what's bad fat, and it's really not so much as that. And these become a little complicated. So the omega-3 fatty acids is usually you'll hear it from the avocado. A lot of people say avocado is a good source of omega-3. Absolutely, and also is a really good source in your cold water fish because they have a little bit higher fat content. So like salmon and tuna that's found in really cold waters, they're going to be a better source of your omega-3 fatty acids. But also you want to be mindful of that because you want to make sure everything's in moderation. If you eat too much of a omega-6, which is usually found in your animal fats, your corn, and your safflower oils, and not enough omega-3, it can actually cause an inflammation response in your body. So everything in moderation for that. And the omega-3s and omega-6 is a whole different topic. But if you want to have a good source of omega-3, it's recommend to have it in your diet. And like I said, you can really get it from your avocado or your cold water fish. Zinc. So you want to remember about zinc, and it's one of those essential minerals, which means that we have to eat that to where because our body does not make it. And there's been a lot of studies out there in zinc that we use this for the immune system, improves brain function, and also promotes wound healing and decreases inflammation. If you do take a zinc supplement, again, you need to make sure you review this with your physician or your healthcare professional, because sometimes you can have too much zinc and it'll interfere with different processes in your body and actually can cause a false anemia, which means a low blood count or that. So you want to be very mindful of zinc. We use it on our end for wound healing, but we only use it for a period of 10 to 14 days. So if you do want to take zinc, like I said, you need to make sure that you review that with your healthcare professional. And also you can actually eat zinc. And most of the time it is found in more of a lean meat, your seafood, your legumes, and your nuts. Vitamin D. We cannot talk enough about vitamin D, especially in women and the prevention of osteoporosis and osteopenia, which is bone loss. Vitamin D also plays a very important role in the immune response and healing, and it regulates our immune cell and also promotes anti-inflammatory cells. Our body can make vitamin D, but you have to have plenty of sunlight. But over the years, as we have become more conscientious of skin cancer, most of the products you put on your skin now does have an SPF. So our bodies do not make as much vitamin D as it did before that. So you want to make sure that if you have to be mindful of being in the sun, because we want you to protect your skin, you also need to include it in your diet, which is dairy and soy products, which is fortified, fatty fish, and also you at least want to take a multivitamin. And when you read the label on the vitamins, it has 600 IUs, international units is what IU stands for, if you cannot get enough sunlight through your diet. So a lot of people do not drink milk, and a lot of people don't like a dairy product, or if you have some kind of condition that you can't tolerate it, then we do recommend a vitamin D supplement. And now a lot of times it comes along with the calcium supplement, especially for women and especially for petite women, because they have a tendency to have a higher risk to develop osteoporosis. Your gut health. So remember how I told you how our skin's our #1 protector, our nose, our mouth. We also need to protect our gut. And the way we do that is what we eat in there. A lot of studies have come out with the probiotics, and that really is not a bad thing to take, but it refers to the good bacteria in your gut. So sometimes when you go on an antibiotic for some sort of infection, the doctor or your dietitian or your healthcare professional may tell you to eat yogurt because it's a good source of probiotics. What we want to do is we want to make sure we maintain the good the good bacteria in your gut that help us fight off infection. So some people that may want to take a probiotic, but again, like I told you, anytime before you take a supplement, you need to make sure you discuss it with your healthcare professional to make sure it does not interfere with any chronic conditions you have or any type of prescription medications you take. You can do it in the pill form, but as a dietitian, we believe food is thy medicine and food first. So what you want to do is to make sure you can incorporate that into your diet, and you can do that by basically eating yogurt. It's a really good source of a probiotic. Sauerkraut, if you like sauerkraut, and pickles, but you have to be mindful of that because it has a lot of salt in it. But yogurt is probably one of your best ways of naturally to get a probiotic in your diet through food. So now I'm going to turn it over to Katie, and she's going to go over some of the current trends that we're seeing right now.
All right, we're switching up speakers on you, making sure you're still with us.
We're good.
So to protect ourselves from COVID-19, a few trends have emerged. We know that the current recommendations are to use face coverings, wash our hands, use hand sanitizer. Again, it's really important that you do this the proper way that DeAnne mentioned. So we just got a great overview of the immune system and scientifically proven ways that we can enhance it to keep us healthy and protected from sickness overall. But there are a few trends going around, like drinking green tea, taking herbal supplements, or other home remedies or family traditions. These methods are, fine and great. If green tea makes you feel great, then by all means do it. But these methods have not been backed up by research. And one that I really wanted to mention is that megadosing on vitamin supplements that DeAnne had mentioned. So on the next slide, there is a little overview of supplements. So again, a well-balanced diet is preferable, but if it's not necessarily accessible, or if your doctor mentions that there are gaps in your diet nutritionally, you may want to consider taking that multivitamin or other vitamin supplements. This is an awesome way to make sure that you're getting those important vitamins and minerals. But when buying supplements, just want to consider some of the following things. So we're going to want to read those labels carefully. There's so many options out there nowadays, different brands, even different forms like capsules, powders, drinks, you name it. And these options are great, but sometimes they can be a little overwhelming and confusing, even for us. So one thing that you can do is look for this USP verified seal. This is going to mean that the supplement is going to actually contain all of the ingredients listed on that label, so that somebody has gone through, a company has verified this, and make sure that it's also made by FDA safe guidelines. So that's one of the first things you can do to make sure you're getting a good supplement for you. Make sure to look up or remember the recommended dietary allowance for that vitamin, basically just how much you should be taking in per day. And unless you've been instructed by a dietitian or doctor to take a certain amount. Also want to pay attention to the serving size. So if you've taken 2 capsules and the serving size is 1, that means you've taken double the amount that's listed on the supplement. So on the next slide, wanted to mention, DeAnne touched on this, but there are some potential dangers of taking too much supplements. So more is not better when it comes to supplementing. Again, these are meant to fill in gaps in the diet and not to megadose. So it seems to be becoming pretty popular to, megadose or take more than the recommended dose in order to, boost your immunity. But in most cases, taking an excess of vitamins is just going to lead to, like DeAnne mentioned, the body using what it needs and just excreting the rest. But some of these vitamins and minerals will actually be stored in the body and they'll kind of stack up. This can lead to symptoms like a headache, an upset stomach, but sometimes in some cases it can actually block or kind of compete with other nutrients, overpowering them, and then that will lead to symptoms of deficiencies from that other nutrient. So it's really important to be careful because some of the supplements can contain 5 to 6 times of the amount of the recommended. So definitely want to be talking to your healthcare provider about how much you need and staying at that level. Again, a multivitamin is a great option as long as we're taking them with these tips in mind. Moving on to the next slide. Again, the best way to support your immune system is through good nutrition. No one food or not even one supplement should be taken over the other because all nutrients work together to create balance in our bodies. So eating a balanced diet with lots of fruits and veggies, whole grains, and lean protein are key to receiving all of the necessary vitamins and minerals. If you can't eat the recommended amount, you may want to, again, talk to your doctor, talk to your dietitian about taking a multivitamin. However, nutrition is just one part of total health, so there are some other ways to improve your health too that we can cover on the next slide. So other ways to improve your health include good night's rest. We want to be sleeping 7 to 9 hours per night. It's proven by science that our bodies heal and regenerate while we sleep, so it's really important that we give our bodies enough time to really be meeting that healthy level. Of course, washing your hands is of the utmost importance, not just now, like DeAnne said. Of course, it's very important right now with COVID-19, but just in general, this is one of the proven ways to be healthy. We also want to avoid dangerous behaviors like smoking and want to be living an active lifestyle. You know, this is crucial to overall health and wellness, and people talk about it all the time, but it's because it's true. And just as important as being healthy and active is taking some time to de-stress, something like meditation or any other self-care activity or hobby that you enjoy. It's all about coming together for the big picture of health, and there are so many ways that we can do this. So on the next slide, we have some great references, some great resources with more information on anything that we covered tonight. And then we can move on and say thank you for your time and attention. Hope you feel good about this topic. I guess we can turn it back over to DeAnne or our lovely host to see.
So we'll turn it back to our host.
Does anybody have any questions or want to say anything? I know you guys have questions. You've all been very quiet. Well, I'll start with a question. Can you talk about a little bit, I know right now it's hard to get in to see your doctor, and you guys said a couple of times, you know, try to go into your doctor, get the best what they, but if you're not able to get tested to see if you're low in any of these vitamins, what do you suggest? Just like a normal daily vitamin or something like that?
So if you feel like you're not really following a healthy diet, which is hard. I mean, it's hard to get 5 fruits and vegetables in a day. I'll just be frank with you. So it is hard for that. However, you know, what you can do is to make sure, like Katie said, to make sure if you get that vitamin, make sure it has the NSP label on there. That means the FDA does not regulate the dosage and the harmful of the vitamins and supplements, but does regulate is a pure vitamin, is true what it says in its ingredients, and is a pure form. So that's very important. Now, if you truly just feel sick and do not feel good, the doctors are seeing you. A lot of them are doing it virtual. So we've become very savvy the last 6 months and able to see people over the virtual. We're doing nutrition education that way. We're able to see patients that way. So they've become very tech savvy. The dietitians have done that. I mean, the physicians have done that to where if you're not feeling well and feel like you need to see a doctor, we definitely encourage you to go either do it from a virtual standpoint, and they'll decide if you need to go in person.
Okay. Diana wants to know, what is the RDA for zinc, and is 30 milligrams daily too much?
Yes, I'm looking at that right now because I want to make sure I tell her the correct number.
Okay.
The RDA for women is going to be 8 milligrams per day, and for men it's 11. It's a micronutrient, which means that we only need it in small quantities. So as far as the 30 milligrams, I can pass that on to DeAnne, but for women, it's going to be 8 milligrams per day for the RDA.
So the only thing for the zinc to take the 30 milligrams, the zinc is stored in your blood and in your tissue. So it's very hard to tell you if you're zinc deficient. The way the zinc deficiency is going to be more like is truly physical characteristics. One of those is a change in teeth and hair loss. So I don't think there's really any harm to take the zinc. What we have to look for is that when I talked about the metabolism and those megadosing of zinc, and thank you, Katie, for that, because you're way younger than I am. I have to look at those RDAs. But anyway, sometimes it can interfere with another micronutrient, which is copper, which can actually is part of the metabolism in your body to make iron in your body. So it actually can make you iron deficient. So that's the reason why for zinc is really hard to do a blood test for zinc deficiency, because like I said, it also lives in the fat in your body. So really we go more off the physical signs and symptoms of taking too much zinc, which would be hair loss and loss of taste.
Okay. Anybody else have something? Oh, Diana says thank you.
No problem.
Okay, you guys are way too quiet. Now, I've always heard, you know, that things like corn, carrots, anything like that are really good fat stores, so you should try to stay away from them in your diet as much as possible, even though, you know, they have the vitamins you need. Is that true, or should we stay, I mean, in small quantities?
Yeah, we don't recommend eliminating anything in your diet. So we'll never tell you. The only thing we do recommend is that you definitely, we do make the recommendation of no trans fat in your diet. That's probably one of the recommendations. Corn and carrots are vegetables. Corn is more of a starchy vegetable, so it does have a high fiber content versus carrot, which is a deeper color. So it's a good source of vitamin A. So the fat content really doesn't naturally occur in that. It's more of your cooking process. And then if you have diabetes, you just have to be more mindful of the starchy vegetables such as corn.
Okay.
So like the fried corn at the fair is probably not a really good thing to eat every single day. It's one of those splurges.
Okay. Anybody have anything? I do have one in Q&A. Okay. Any limitations on fatty fish per week? From Patricia.
So no, like I said, the fatty fish does have a higher omega-3 in it because it's a cold water fish, and we do recommend incorporate fish. It is considered a lean source of protein. So really, the only thing is that if you're pregnant, you have to watch for the mercury in those fish naturally occurring. So we do recommend for you to monitor that if you are pregnant. And again, it's going to be the way you cook it. You know, everything is like a salad's fine until you go add the whole bottle of dressing to it. You know, so it's just really is moderation, the cooking process of it, and what you add to it.
Okay. Must have a bunch of healthy people on here. You guys are so quiet. Well, if you don't have any questions, I'm not going to keep these lovely ladies.
All right. Well, please feel free to go to tmh.org, and you can put TMH for life and hit the Eat Healthy. And there's a lot of resources on there as well, where people just want some good background. And that's all. You know, we are science-based nutrition, so we just do encourage you to please be mindful of when you're reading nutrition information that's coming from a valid, credited resource.
We do have two questions popped up.
Okay.
Constance would like to know, what about chocolate?
What about it? It's good.
Everything in moderation.
Exactly.
Everything in moderation. So, you know, they'll say dark chocolate is better for you than the light chocolate. It just depends on your preference. And, you know, I'm not going to tell you cannot eat chocolate. We encourage you to, you know, learn how to you know, everything in moderation and choose what you want to eat. And if, you know, like I tell you, balance it out. It's kind of like someone who has chronic disease and they really want something in this diet. Just make sure if you're going to eat that, like say for instance, say I'm diabetic and I really wanted that piece of cake. Okay. I'm not going to say you can't have it. I'm not going to say you can't have it every day, but if you're going to do that, be mindful what you eat around it. So make sure when you're eating something like that, just make sure you're balancing it out. So it's all about moderation and balancing. So yes, to your chocolate, you can have it. It's not the whole bag at one time.
Not the whole bag. Oh, come on. Okay, Patricia would like to know, can we get a copy of the Color Foods chart?
I will send that to it. I'll ask a FAF and see if we can send it to a PDF to you. You can do that. So I'm pretty sure those are one of those.
Okay.
Those are one of those good food charts.
Okay, if you guys want to reach out to me, I will talk to a FAF and see if I can email it straight to you.
Yes.
So if you'll reach out to me via email, and most of you know my email, but I will put it on here.
I think we have another one.
Yes.
If you want to boost your immune system with vitamin C, how much daily should you take? So
RDA for vitamin C is 75 milligrams for women and 90 for men.
Unless you smoke. If you smoke, I'm sorry, Katie, real quick. If you are a smoker, you do need higher requirements for vitamin C.
True. Yes. Food-wise, some good ways to get to that level could be 1 kiwi actually will meet the RDA for vitamin C. A cup of strawberries or 1.5 oranges, about like 1 to 2 oranges. But like DeAnne mentioned in the presentation, it's really like the citrus fruits and lots of fruits and vegetables. If you're supplementing, definitely want to be asking your doctor or dietitian for the recommended amounts, but the RDA is 75 to 90 milligrams.
Right, and then also you can take up to an upper limit of the 2,000 milligrams. However, though, it may cause you some GI distress with that. And again, if your body needs it, it'll use it. If it's not, you're just going to excrete it. So vitamin C is one of those vitamins that really the megadosing is not going to be as harmful as you did one of those fat soluble vitamins such as vitamin A or vitamin E.
Yeah, one of my teachers explained it one time. It's with vitamin C, you know, it's not necessarily going to hurt you if you take a lot, but you're going to have really expensive urine. So
exactly. That
you don't really need to be taking
well.
Yeah.
Correct. Yes.
Okay. How do you know if you're deficient in any particular vitamin if you don't feel like you're deficient?
Then you're probably good. You know, you have to go by how your body feels and what it feels like. You know, as we do get older, you know, we do have higher risk for being really more of a vitamin D deficiency, which is more common. So there's special testing that they do. They do bone scans as we get older for women's health. But if you feel good, the likelihood of you being vitamin deficient is very minimum. So if you feel healthy, your normal self, you know, you're not tired all the time and have a healthy diet, and you're pretty good.
Okay. And DeAnne would like to know, she'd heard that TMH is using vitamin C, D, and zinc as part of their COVID treatment. Do you know if that's true?
So there's really so with our COVID patients, this has been a little bit of a learning process. So it really depends on the patient, how long they've been sick, and how their intake has been. I will tell you, starting in March, when we started having our first COVID positive patients, they were very much more sick than what they are when we had more of a peak in May and June. You know, so it really depends on that patient. It depends on their chronic condition. So it's really individualized. So we feel like if someone needs vitamin C for healing, we'll give that to them. If we feel like someone is deficient in D, we'll give that to them. And then zinc would be the same way. So it really is, every patient is different with the COVID, how it impacts them if they have a chronic condition. So I'm not going to tell you that we're not using it. I will tell you there's an individualized treatment for each of those patients.
Okay. Anybody else? I was wondering, we have heard so much, and I know a lot of people that use CBD as a supplement in some way for skin or for, you know, improvement of hair, anything. So I was wondering if CBD, do you know anything about the benefits, the effects?
So I really haven't done much CBD oil research. We don't get a lot of that in our patient population. We probably get it more into our we have a tendency with patients who are being treated for cancer, look for more alternative solutions, alternative treatments for that. So really that's where I just encourage you to really talk to your doctor if you're going to do that, to see if it makes sure it does not impact with any of your medications. And I'll give you an example. It's not really a CBD oil, but I'll give you someone, say maybe you have hypothyroidism, so your thyroid doesn't work really well. You have to take a thyroid supplement. one of those things, they're taking a supplement, a multivitamin with minerals. You cannot take it with that thyroid medication because it interferes with the availability of the thyroid medication once it gets in your blood. So the efficacy decreases in your body. So when you start going to an herbal supplement, which is what CBD oil is for, there's no regulation to it. You really need to discuss that with your physician if you do have a chronic condition or if you're on a prescription medication.
Anybody else? I can't believe you guys have been so quiet. We usually have 100 questions. Well, obviously, you've presented everything that they wanted to know. So.
All right, so we'll definitely send the PDF out for the phytonutrient chart, and
Great.
We'll try to get that out to you, or you can get it to the people who are requesting.
Okay, perfect. Thank you so much, DeAnne. Thank you, Katie. And next week, I want to make sure, oh, absolutely. Please make sure to join us next week. We're going to be sipping with science and talking about finding fluorescence with a PhD student from FSU, Courtney Witcher. She's going to be talking about bioluminescence and tying that into our night prowl, which will be on Saturday. So if you're able to join us on Thursday, you'll learn about what we're going to be talking about on Saturday. So maybe if you're local, you could do both. Let me know if you are interested in doing both, and I'll get you set up. So hope to see you next week. And again, thank you, Katie and DeAnne. I really appreciate you being here, especially DeAnne. She ended up being a replacement this week and did a fabulous job on the last minute notice. So I'm very grateful to you. And everybody be safe and well out there, and we'll see you soon.
And wash your hands.
And wash your hands.
Thank y'all.
Right, thank you. Bye-bye.
Thank you.